morning. I'm Dr. Mickey Barber with Better Life Carolinas, and this is Kelli Evans. She's our nurse practitioner here at Better Life Carolinas in Charleston, South Carolina. We just wanted to take you on a little tour this morning, so come on in.
Welcome to Better Life.
Good morning, Lindsay.
Hi,
Lindsay usually will be the first face that you see in the morning when you come in, and she can help get our day started. So, Lindsay, thanks so much for being here. We just want to take a little turn here and show you our pharmacy. I think some of you may have already seen some of our videos about our compounding pharmacy that is upstairs. This is where the orders are put together, so where the capsules are counted, the orders are organized, and then shipped out from here. Nikki is in charge of our pharmacy, and you'll be getting to know her as well.
All right, and we can kind of pan out to our front lobby a little bit more. And then we will walk you guys through our little hallways into some of our rooms just to give you guys an idea of what Better Life looks like. So follow us through here. In our first room here, we have Christy, who's one of our patient special care specialists. And if you come walk in here, this is kind of more of our men's treatment room. Here you can see we have the Gainswave treatment. We do help men with erectile dysfunction. We also perform the P shots with the PRP as well. You will also talk with Christy. She does help to do scheduling, and she does do some of the Gainswave treatments as well.
Just a note, we also use exosomes, which are very powerful microparticles that are part of amniotic stem cell fluid. They work very well as part of the P shot or as part of the O shot, which we do in this room. We think of this more as the women's room over here, which is really focused on improving women's sexual health, vaginal lubrication, pelvic rehabilitation, really keeping everything the way it was when we were in our 20s. You want to speak a little bit, Kelli?
And if you'll walk in here, we do perform what we call our Vivive treatment. This does help with stress urinary continence, all urinary incontinence really. It does help with some lubrication as well. It's a great and wonderful treatment. We are excited to have this for our ladies.
Kelli, what is stress urinary incontinence exactly? Maybe the women don't know out there.
If some women don't have this experience, it's mainly under stress, like coughing, sneezing. You will leak a little bit. You're just unable to control your bladder symptoms. Urgency is more of just needing to go frequently, sometimes throughout the night or even throughout the day. You may have to wear a pad most days. So this is what this treatment, this Vivive, can help with.
So those women that I see at the gym that say, they can't do jumping jacks, they can't go for a run, they can't do box jumps because they pee their pants, this could help?
Exactly. And the best part about it is it's a radio frequency cooling system, so it does go deeper into the muscle area of the vaginal tissue. And it's a quick 30-minute treatment, and then you're done. And there's no downtime, which is the best part about this treatment.
None of us like downtime, that's for sure. Just our least sexy room over here is our lab and our processing room. So this is where when we do blood draws, when we pull out your blood, spin it down to do our PRP, which is platelet-rich plasma, which activates the stem cells in your body. That's all processed right here in the lab. So we have everything at our fingertips to be able to get you in and out as quickly as you'd like, which seems as top priority for most people.
Right. And our next room here is our examination room. We do a lot in this room. So we do our physical examinations, we do pellet insertions, we can do testosterone and estrogen for women. Here you'll see our VO2 max bike. When you do come in for your evaluation, we do allow you to get on this bike. It does measure the amount of oxygen intake during physical activity. We do also do our strength test here. So this gives us a lot of information about your overall health in this room. We do a lot here.
You know, a lot of people know that they should exercise, right? But they don't know what's the right exercise program for them based on their strength, their cardiac ability, their pulmonary function. So this testing allows us to write a specific physical activity program for them based on the starting point, and then to continue to monitor that over time. Let's take you in the next room.
We have many rooms.
Kelly, you want to talk about
All right, so this you'll see our big machine here is our DEXA scan. DEXA meaning that it's a bone density evaluation and your overall body fat percentage as well. So it gives us a good indication of your health as far as risk of osteoporosis and just where you are containing most of your body fat. A lot of people really enjoy seeing the results when they do start our program. We can repeat it in a year, and it's amazing to see some of the benefits that people are receiving. Also in this room, we do a cardiovascular risk assessment test. It will give us an indication of your overall vascular health. It also will give us kind of your parasympathetic and sympathetic nervous system evaluation, so your stress evaluation as well.
One of the things I want to say about the DEXA, so that is the gold standard measurement for body fat and body composition. There are other things out there, stepping on the bioimpedance scale, holding the calipers. This is the gold standard, so we can repeat it every few months and really see progress, because a lot of times it may not be what you see on the scale, because you may gain muscle mass and the scale doesn't move that much, but if the body fat's coming down, that's what we want to happen. So anyone can have a DEXA scan done, so it might be something that if you're kind of setting up a new fitness program for yourself that you might be interested in. And then we have Maddie.
Hi.
Maddie does a little bit of everything. She keeps our patients happy, answers the phone, schedules appointments, and works really closely with the rest of our team.
And this is, on this wall right here, you will see our kind of motto for life. We're here to provide a better life for our patients, and our hope is that if we see this every day, we can provide a better life for ourselves as well. So we're in the journey with you guys. And this room is one of our consultation rooms. So when you do come in, if you have any lab results or for your first evaluation, you'll meet in here with either me or Dr. Barber. We will discuss different testing results, discuss your plan of care overall. So it's a good room we have good conversations in these rooms.
Our goal when we set up Better Life Carolinas was to have an environment that was not intimidating, didn't feel like a more conventional doctor's office. So we try not to have patients waiting to get in, where you're sitting in the waiting room for 30 minutes and then in another cold room for another 30 minutes. So we want to make it real comfortable for you and non-threatening. Part of that is having what we call the relaxation or rejuvenation room, which is very comfortable. You can sit back here and read, you can relax, get on your phone, whatever it is that you would like to do in the short amount of time that you might be waiting here.
And we really do pride on the amount of wait time, so we really want to see you guys as quickly as possible. And this room right here is our aesthetics room. So we do a lot of our vitamin infusions that we can also do exosome infusions as well. Christine is our aesthetic specialist, so she will be doing microneedling with the PRP and exosomes as well. Any kind of aesthetics consultation, she'll bring you in here. We do also have our skin line products as well. Our Lifeline Pro Plus is in here. And so this room is very good.
For some people, it's hard to take vitamins, hard to remember to take vitamins, so to be able to give them IV, particularly if you're getting ready to go on a big trip, or you just got back from a big trip and you feel a little under the weather, or you just got your toddlers in preschool and everybody's carrying around bugs, it's a great way to really boost your immune system and get those vitamins on board quickly. So it's our Better Boost program. And we have different packages, and most of our patients find it really helpful to stay hydrated and to stay nutritionally intact.
This is one of our other consultation rooms as well. But we do have this in our room here. We have our cognitive evaluation test. This is very important. It will give us a clear indication of your overall focus ability, memory intact. How is your memory? Is it declining? Is it improving? We get a lot of results from this test, and it's pretty fun actually to take the test. It gives you a challenge, that is for sure.
You know, Kelly, I would say in my 18 years of doing this, at the top of the list for patients as we age is worrying about our risk of dementia and Alzheimer's and cognitive decline. As far as I know, we are the only practice that has this sort of testing as part of our ongoing evaluation of our patients. And we have picked up early dementia and early Alzheimer's in patients, and early being the key word. Most of the time it's very reassuring because people are intact, but it gives us another piece of information to really jump on any changes or decline early and come up with programs and protocols for those patients. So it's a 30-minute test. I don't know how fun it is, but we think it's a really important part of what we have to offer. One more room on our agenda. This is Todd Fox. Todd is our go-to guy for nutrition, exercise. He helps us a lot when we're looking at new products and new technologies to really find the data that's out there and if it's a good fit for our patients. He's also quite physically fit, as you can see. He's got his treadmill desk.
If you come in here, you'll actually see his exercise ball. So he has very many different positions throughout the day. So you'll walk by and he'll be sitting on the ball or he'll be sitting against the wall. He's very active throughout the day.
We're just going to come back down here a minute. So just to let all of you know, we really believe in what we do. We think we're more passionate than most physicians' offices you're going to find out there. And we have a great team. Everything that you've seen here in the office, we also have in our Charlotte office, with the exception of the compounding pharmacy, which is only housed here. We have a whole nother team up there. We have Stacy, our nurse practitioner. We have Katrina, who's our exercise and nutrition expert in Charlotte. And we have Stacy, we have Crystal, who is our patient specialist and phlebotomist. So we have a great team, and we really would love for you to be part of Better Life Carolinas.
I hope this helps.
Yeah, please check us out.